Hello everyone, and welcome to our November staff meeting. The topics of our staff meeting today really focus on looking forward, because really, who's not ready to get rid of the year 2020? What that looks like is a preview to our 2021 business planning, a celebration of our brand transitions, and preparing for some exciting opportunities in IT with an IT roadmap. Before I turn it over to Joe to go into our business planning, just a quick reminder and a thank you for helping to keep each other safe and healthy by adhering to some of our more recent changes to our COVID office protocols. Thanks everyone, enjoy the meeting.
Hi PHSers, this is Joe Dietlein. I'm the Chief Strategy Officer here at PHS. I am talking to you from my home office outside of Milwaukee, near our Pewaukee office. That's why my background's a little bit different from everybody else. I get the opportunity to talk to you today about our 2021 business plan and our planning for the year. As we think about the planning for 2021, we have to think about 2020 and the experiences that we've had and where are we ending up? How did we do against our plan for 2020? This year, we saw a big old change in having a pandemic. Nobody anticipated that one. So I want to congratulate the entire company for how well we've fared through the pandemic. We've been able to maintain and grow our business. We've been able to serve our partners and our families and our patients consistently. And I feel like while it affected our business, generally, we were able to adapt and move forward. And congratulations, that's because of all of you and the hard work that you bring every single day. We've seen this year an increase in cost of our inventory and our cost of goods sold. So as we think about the year ahead, we think that will continue and have taken that into consideration as we've been planning. 2020 brought us a lot of new people through our integrations, through our growth. It brought us a new organizational model with our GMs and our enterprise functions, our customer-facing folks. And it also brought us a lot of integration and due diligence work that was associated with corporate development. And all of those things are taken into consideration as we build the plan for 2021. When we think about planning, really, our goal is to advance our uniqueness statement and what is unique about PHS for all of our markets. I'm going to read our uniqueness statement because this really is the foundation of how we want to add value anywhere that PHS is or PHS plans to be. We offer unparalleled hospital at home service designed for children with medical complexity and their families, provided by a team of experts dedicated to serve with compassion. That's what makes us unique. In order to take that uniqueness and put it into planning, we use the PCOE, the Pediatric Center of Excellence, and the different pillars that are associated with the PCOE. All of our goals are aligned with one of these pillars. And as we think about how to advance our uniqueness, we know that we have to invest in each one of these pillars in order to add value and make sure that we're growing in the right way for our patients and for our partners. In 2021, we're going to focus on growing in the right way. And the areas that we want to focus are aligned with our various pillars within the PCOE. For quality outcomes and patient experience, we're going to be implementing a best-in-class EMR solution across the service lines. For each service line, the best-in-class EMR solution. We'll be aligning our accreditation bodies across our markets. In focused research and development, we had a great year in 2020, and we want to continue to do that into 2021. Our goal of publishing at least 2 peer-reviewed articles on children with medical complexity. Operational excellence, we want to optimize our enterprise organizational design model. So we have scale. Let's take advantage of it with purchasing, revenue cycle, and billing in particular. We'll also be solidifying and aligning our KPIs by market and across markets. So as we grow, we know exactly what we're trying to do, and everybody understands how we're measuring the business and how we're measuring the work that they do. We're going to continue to further develop the Pediatric Center of Excellence by determining the most suitable service to roll out in each market. Folks in Texas, you know about this with the addition of infusion nursing and the infusion pharmacy. We'll be considering that in all of our markets for potentially adding new services. We're going to focus on comprehensive care. So everyone will have heard of this by now, but our goal is to make sure that we're taking care of our families as much as we can with as many services as we can. In community integration, we'll transition all of our locations to the PHS brand and logo. And then also we'll be rolling out our sharing care program in each one of our markets. Finally, with advanced professional staff, we'll be rolling out our corporate training in all of our markets in the year to come as well. Now, in our markets in particular, in Kentucky, we have had that team on board for about a year. Congratulations. It's fantastic. The Brightree migration and integration has occupied a lot of time through 2020. We've already started a service area expansion through development of relationships with Cincinnati Children's and University of Kentucky in Lexington, among other referral sources. In 21, we're going to focus on extending that service area further. We'll be adding a location near Lexington to service the patients that I mentioned a moment ago. We're really going to focus on high-tech referrals in all of our referral sources through outreach and relationship building, and then also on building our comprehensive care opportunities with our patients. Finally, Mike Downing is going to be retiring, and Carolyn Bassford will be transitioning into the general manager role in Covington. Congratulations, Mike. We wish you nothing but the best, and I look forward to working with you as closely as possible over the next several months. In the Minnesota market, we've had a really strong growth year across service lines, particularly in infusion pharmacy and home care nursing. The cost of goods sold and inventory that I mentioned before, it's been a record year in Minnesota for those costs, Minnesota and Wisconsin, including drug and supplies. In 2021, we really need to think about the effect of the pandemic on costs that the Medicaid system is going to be considering and changes to the state budget. Also around HCN, we've seen that hospitals have been laying off nurses, and we've been able to take advantage of that with a good nursing supply and an ability to grow our HCN business. That may change in the year ahead. We also have the systems migrations that I mentioned before. Preparation for that and planning to implement will fall heavily on a number of the subject matter experts in our Minnesota market. We want to maintain our solid momentum in DME, enteral, and IV in our Minnesota market. We're going to focus on the mother-baby patients to grow our skilled nursing visit business and our home health agency business. And then we're going to maintain that steady growth based on the nurse availability in our HCN or home care nursing business. In Texas, Houston and Dallas are approaching their one-year anniversary as well, and San Antonio recently came on board. All locations have achieved very good growth throughout 2020. We want to maintain that. We have all locations in new locations within the year. Houston will begin a move before the end of 2020, while San Antonio and Dallas are already in new locations. In 2021, we're going to launch infusion pharmacy and nursing in May across all of the locations. We're also going to add an Austin location in the middle of 2021. First, that location will focus on DME and enteral, and then we'll add infusion nursing before the end of the year. We really want to focus on increasing our high-tech referrals with a particular focus on Dallas and San Antonio. Finally, we have an opportunity to increase our comprehensive care across all of the locations in Texas as we grow and are able to provide more and more services to the families that we serve in that gigantic market of Texas. In Wisconsin, so 2020 was strong overall. We've seen the slowing growth at the end of the year. The competitive landscape has shifted in Madison and Milwaukee, and we're adapting to it. We added payers throughout the year with a key addition of Anthem over the last couple of months, and we should see that increased growth of referrals as we are removing barriers to being able to serve patients. In 2021, we'll focus on new partnerships like the partnership with Children's Medical Group around Billy Lights. We'll focus on being able to adapt to new processes coming out of our main referral source of Children's of Wisconsin. And then we'll also work on relationship building and new referral source locations, Marshfield, Green Bay, and the Fox Valley. We've already started, but we'll continue to deepen those relationships. At the enterprise level, we've talked about a lot of these initiatives, but specifically, we'll complete the transition to Joint Commission as the accrediting body for all of PHS, implement Brightree for pharmacy expansion in Texas, and begin a CPR Plus conversion to Brightree in Minnesota and Wisconsin for DME and Enteral. We'll work with vendors as one purchasing entity to begin to realize our scale and our ability to purchase, and then we'll determine and implement a clinical charting solution across all locations that should improve our efficiency in our clinical work and our employee satisfaction. We'll be expanding our services. We've mentioned all of these in other slides, but are excited to offer IV pharmacy and nursing in Texas and expand into Austin and Lexington with our services. Then we'll continue to look for additional integration and acquisition opportunities in all of our markets, as well as new markets. This is how the map looks in 2020. It's exciting. We have all of our co-brands and our partners that are growing across the map. As we get into 2021, we'll be unifying the brand under the PHS banner. We'll keep Pulmonary Partners in Covington, but all of the locations, you'll see Lexington and Austin added to the map, and PHS will be the brand and the logo in 2020 for all of our locations. I want to congratulate everyone on a great 2020 and an exciting 2021 ahead. And then I'm going to transition to Dana Johnson, our Director of Marketing, who's going to talk about branding.
Hello everybody, Dana Johnson here, Marketing Director out of our Minneapolis office, or during COVID times, my living room. So welcome in. I am thrilled to be here today to be talking about a really exciting change in our organization's history, and that's brand unification. So you might be wondering, what in the world is brand unification? Well, let's dig in. So for the past, about 3 months to a year, our Houston, Dallas, Covington, and San Antonio offices have each been operating under what we call a co-brand. A co-brand takes the organization's legacy, business name, and logo and brings in the PHS name to accompany it. Our goal during a co-brand period is really to bring awareness, to build familiarity, and gain traction for the Pediatric Home Service name and brand in our new market spaces. So now we've had those in place for a period of time, and we really feel like the time is right to transition from our co-brands into PHS's name completely. So starting January 4th, we will be welcoming all of our expansion locations under the PHS name. We will be one organization across the country. So it's very exciting times for us. We wanted to take this opportunity to not only welcome the organizations into just PHS's name. They've been a part of our family since day one, but it's really a big, exciting change for us to have PHS locations and employees spread across the country. So we've been hearing some questions though on, how do I refer to our Houston office, or how do I talk about the Dallas branch or San Antonio or Covington? And I just wanted to make sure that we were all clear and on the same page. We're really excited about going from an us, them, you, me to a we. Really thinking through how can we make sure that we're being inclusive and that we're one family and one organization, and that's represented not only through our business name but also through the way that we talk about one another. So it's pretty simple. If you've been on the hub since this transition has started to take place with acquisitions, you will have noticed that we've started using the vernacular already, and some of you this is already second nature to you, but we just wanted to take the time to clarify it for any of you who might have questions. So I am out of the Minneapolis office, formerly known as Roseville. We've moved into a naming structure that represents kind of the general metropolitan area of that service area. So we have our Minneapolis branch, MSP. We have our Milwaukee branch, MKE. We have our Houston branch, HOU. Our Dallas branch, DAL. Our San Antonio branch, SAT. And our Covington branch, COV. So you can really use either the city name or that abbreviated name, and either are perfectly appropriate, perfectly acceptable, and very inclusive. So we're really excited about this new change, this transition in our organization's history and just the growth that we're experiencing. And I want to thank everyone for all of the work that has gone into making sure that this is a successful transition. So thank you for letting me be with you here today to talk about this. I'm going to pass the baton over to Rick to talk about IT infrastructure, and I hope everyone is staying safe and healthy. Thanks so much.
Hello everyone, I'm Rick Mueller, your IT Director for Pediatric Home Service. Just wanted to give you a brief update on 3 topics today. First, on our help desk, I want to welcome E to the team. He's our new help desk analyst. We are also bringing on a new help desk contractor too to help resolve help desk tickets as quickly as possible. We're also keeping an eye on the metrics as we roll on new users and new sites into PHS so that we stay in front of the need and bring on additional resources as are required. The IT support, as always, can be reached at helpdesk@pediatrichomeservice.com, 651-444-5555 for daytime support, and then we have our on-call and after-hour support 24 hours a day, 365. Wanted to mention our laptop policy as well. Most folks now that are working remotely have a PHS-issued laptop. Just a quick reminder to be using that laptop when you are working from home or really doing any PHS business. This will ensure that you're receiving the latest versions of our applications, maintaining a secure device, as well as having the best experience possible with our PHS systems. Now on to some enterprise application updates. The first of which is a new Microsoft Teams phone system that we're deploying. We have set this up in Dallas, Covington, and Houston in the last quarter, and we'll be rolling it out in Roseville here in Q4. So there will be some meetings with the folks in Roseville over the next few weeks as we design the new phone system, with an implementation happening sometime in December or January. We are also, through the integrations work that we're doing, as well as any project that we're working on rolling out a new Microsoft project system. This is different than the one that many of you are using today, but we're working with a third-party consultant to bring an actual holistic Microsoft project portfolio management platform to PHS so that we have a really clear, established system and process for managing projects here at the company. Lastly, on enterprise systems, many of you are used to using M-Files for your document management system. We'll be working on an integration between M-Files and Microsoft Teams. Now on to the electronic health record. So many of you are using Brightree as your durable medical equipment and infusion platform. We're working on the Texas infusion piece right now, which will bring infusion pharmacy functionality to the Texas market, as well as establishing process groups to centralize our processes and procedures for all of Brightree across all of our different sites as we look to roll all of PHS onto one tenant here over the next year. In addition to Brightree, we're also rolling out the MyUnity platform over the next year. That is our patient-centered system that will be patient-focused, as I mentioned. All of the clinical documentation, the referrals, interoperability with other healthcare providers will be built into that system with a deep integration between Brightree and our other electronic health record systems. Lastly, on an EHR platform, we are rolling out the Apacheta mobile delivery to sites that don't currently have it. So that should be occurring within the next few weeks. We're very excited for that rollout and bringing those efficiencies to those other sites. MD Clarity is another partner that we're working with to bring a holistic AR management system for Brightree, MyUnity, really any of our electronic medical record systems that will be rolling out to the billing teams here in the next few months. And then lastly, our MyPHS portal and online ordering system. Those in Minnesota and Wisconsin are used to this as a way that our patient families can order supplies from our organization and ties into CPR Plus. We're working with a third-party vendor to bring that functionality to Brightree as well. We're hoping to have a project plan finalized here within the next few weeks to a month, and then work in 2021 to bring that to market for the organization. Again, if you have any questions, please feel free to reach out to myself or anybody on the IT leadership team. Thank you very much.
So that's a wrap on the recorded portion of the meeting. I look forward to talking with you all at the next Q&A session. Thanks, everyone.